Let's talk about why we get the common cold frequently and how to stop it. The common cold is a viral infection that usually affects the nose and throat. Rhinoviruses are the most common cause. The first and most common sign of the common cold is nasal congestion, which is when you feel blockage or fullness in your nose.
The second most common sign is a runny nose with clear or yellow discharge. The third is a sore throat with irritation or scratchiness. Fourth is a cough, which is mild, but can persist after other symptoms resolve. And sneezing, which is a reflex response to nasal irritation. Other symptoms, like a low-grade fever, mild headache, fatigue and muscle ache, are possible, but rare.
An upper respiratory infection is a broader name that can include other diseases like sinusitis, pharyngitis, and otitis media, but the common cold is the most common among them. A cough is common but mild. If a cough becomes severe, productive, or associated with fever, it indicates bronchitis, a lung infection, or pneumonia. Adults usually get 2-4 episodes of a cold per year, and children up to 10. The common cold up to 6 times per year for an adult is considered a normal variation. For example, if a person has high contact with viruses, for example, school-age children at home, or travels frequently, or works in crowded places. The most common cause of frequent infections is a weakened immune system. Most commonly, chronic stress. Increased cortisol, a stress hormone, suppresses the immune system. Lack of sleep, especially deep sleep problems, reduces immunity importantly because of reduced cytokine production, which is critical to fighting viral infections. On the other hand, vitamin deficiencies like vitamin C, vitamin D, zinc, and vitamins B6 and B12 can cause a weakened immune system. Chronic diseases are also associated with an increased risk of the common cold, such as allergic rhinitis, asthma, chronic obstructive pulmonary disease. Diabetes, mellitus, hive infection, and autoimmune diseases like lupus all decrease immune system function and cause local inflammation, which increases the risk of infections. In rare cases, cancer and chemotherapy can both weaken the immune system. Now let's say what decreases the frequency of the common cold. Vitamin C is the most well-studied and commonly noted supplement for the common cold. Vitamin C is ascorbic acid and it's a powerful antioxidant. It promotes the production of lymphocytes and phagocytes, which are crucial white blood cells for the immune system. Also, it boosts the production of interferons and cytokines, which play a role in directing immune responses to viruses. Vitamin C is especially effective in athletes, people in high physical stress, and in cold environments. Regular intake of vitamin C decreases common cold risk by 50% in such populations. The recommended daily dosage for men is around 90 mg daily, and for women 75 and 35 mg higher dosages in smokers. Up to 1000 mg of vitamin C intake daily is considered safe for the long term. Usually it is prescribed around 500 mg daily. High dosages of vitamin C also increase kidney stone risks. You should limit it to under 1000 mg daily. Vitamin C can be taken with or without food, but for better absorption, it's better to intake it with small portions throughout the day.
Supplement, but it's effective if a person has a zinc deficiency. In this case, supplementation reduces frequency of infection and improves immune system function. Zinc intake decreases the duration and severity of the common cold, and regular intake decreases the risk of the common cold. Especially effective are zinc lozenges, taken within 24 hours of symptom onset, and it reduces symptom duration and the severity of the common cold. Zinc binds to virus proteins and prevents them from attaching to the respiratory system. Also, zinc stimulates the production of white blood cells and cytokines, enhancing the body's immune defense. It also reduces inflammation and lowers oxidative stress. The typical dosage is 75-100 milligrams per day, divided into lozenges, typically 10-15 mg per lozenge. Continue until symptoms improve, 5-7 days typically. Zinc gluconate or acetate are common forms of lozenges. The preventative dosage can be up to 40 mg per day, but in generally healthy people it is not recommended.
Excessive zinc is not recommended because it can, conversely, suppress immune function. Do not intake more than 40 mg daily for the long term. Zinc is best absorbed with food, especially meat, but avoid fiber-containing food for better absorption. Vitamin D is another important supplement. It can reduce the risk of respiratory infections, particularly in individuals with low baseline levels of vitamin D. It enhances the pathogen-fighting effects of monocytes and macrophages and decreases inflammation. Also, vitamin D enhances the proliferation and function of T cells, which help prevent overactive immune responses and reduces inflammation. According to meta-analysis, people who regularly intake vitamin D have a 12% lower risk of respiratory infections. And this effectiveness is up to 50% if the person has baseline low vitamin D. 800-1000 international units of vitamin D daily is considered the optimal dosage for most people. In obese and smoker individuals, higher dosages can be required.
Echinacea is the fourth most important supplement. Echinacea reduces the duration and severity of colds by 10%. However, its prevention property is inconsistent. Echinacea stimulates white blood cell production, macrophages, and natural killers. Also, it activates cytokinase that regulate immune response. Also, it has anti-inflammatory cytokines which prevents excessive inflammation. 300-500 mg of Echinacea extract for cold season immune system support is a typical dosage. Higher dosages can be used for the short term, several days. More than 8 weeks of Echinacea is not recommended due to liver toxicity, and it can have a negative effect on the immune system in the long term.
The probiotics are the fifth. They are effective for reducing common colds and enhancing immune system function. Probiotics enhance the activity of immune cells, such as macrophages and natural killer cells, and increase the production of antibodies, therefore strengthening the immune system. They inhibit the growth of harmful bacteria and viruses and improve the integrity of the gut lining. Especially effective strains are Lactobacillus rhamnosus AG, Lactobacillus paracasei, and Lactobacillus plantarum. Lactobacillus is usually intaken as colony-forming units (KIOS). For immune support, doses are from 1 billion to 10 billion per day. Usually it is intaken for a minimum of 30 days. Longer durations, such as 12 weeks, also have positive effects on preventing the common cold. Up to 6 months is considered safe. Typical dosage is 5 billion CO. For example, Lactobacillus rhamnosus with a meal improves the survival of bacteria through stomach acid. Fat and fiber-rich foods are best. Taking it in the morning with breakfast is considered best. Taking it at the same time is optimal for colonization. Lactobacillus rhamnosus can reduce the risk of respiratory infections by around 20%, even higher in children. Up to 25 degrees Celsius is safe. Heat, humidity, and light reduce its life. 28 degrees Celsius or 35-46 Fahrenheit is optimal for most probiotic storage.